Hello, viewers. Welcome back to our channel. Today, we have a heartbreaking story to share with you. Anna Louise Marsh Reese, the daughter of Ian Marsh Reese, who tragically passed away after contracting COVID-19 while in hospital, has recently spoken out about the treatment of COVID-19 victims and their families. In her testimony at the COVID inquiry, she described her father's harrowing experience and the shocking aftermath of his death. Let's delve into the details. Anna Louise Marsh Reese, who leads the COVID-19 bereaved families for Justice Cymru, shared her family's ordeal during the COVID inquiry. Father, Ian Marsh Reese, aged 85, lost his life to the virus after battling for breath while in the hospital. However, manner in which his body was handled and the lack of information provided to the family left them devastated. According to Ms. Marsh Reese, discovering information about her father's care in the hospital and how he contracted the virus felt like solving an Agatha Christie mystery. Her father was moved 6 times within a span of 8 days, and upon his discharge, the family was unaware that he had been in close proximity to COVID-19 positive patients. They later discovered that the ward had been shut down due to an outbreak, but they were never informed of his exposure. Despite being discharged, Ian Marsh Reese's health rapidly deteriorated, and his mother, who shared a room with him, also contracted COVID-19. She made numerous calls to the general practitioner, GP, but COVID-19 was never suggested as a potential cause. It was only later that the family found out from his discharge notes that he had indeed been exposed to the virus. To their shock, the family discovered that a do not attempt CPR. The prayer order had been placed on Ian Marsh Reese without any consultation. This lack of involvement in such an important decision further added to their grief and frustration. Ms. Marsh Reese expressed her concern over how COVID-19 victims are treated after death. She mentioned that they are almost treated like toxic waste. Bodies are swiftly zipped away, and families are not informed about the limitations placed on funeral ceremonies, such as being unable to wash or dress their loved ones. Singing, an important part of Welsh funerals, was also prohibited. These restrictions add to the emotional distress experienced by families during an already difficult time. In light of her father's experience and the experiences shared by other members of COVID-19 bereaved families for Justice Cymru, Ms. Marsh Reese emphasized the need for better preparation and support for families before and after the death of a loved one. She highlighted the importance of palliative care and ensuring dignity in death. Additionally, she expressed her hope for improvements to occur within her mother's lifetime, as many individuals from her mother's generation lack the means to voice their concerns and are left heartbroken and in shock. The testimony given by Anna Louise Marsh Reese during the COVID inquiry sheds light on the distressing treatment of COVID-19 victims and their families. The lack of transparency, inadequate communication, and the handling of deceased individuals contribute to the emotional burden endured by grieving families. Ms. Marsh Reese's call for change serves as a powerful reminder that improvements are necessary to provide support and dignity to those affected by COVID-19. We hope that her efforts, along with those of other advocacy groups, will lead to positive changes in the handling of COVID-19 cases and the support offered to grieving families. Thank you for watching, and please remember to take care of yourselves and each other during these challenging times.